I now call the Iberia Parish Council meeting to order. It is now 6:01. We'll start with a prayer led by Councilman Paul Landry.
As we gather here today, we ask Jesus to lead us to do the business of the people and get us through all the rough times and get everything working together. Amen.
Amen, John. All right. Next, we'll have the pledge led by Mr. Gaston Dubas. Mr. Gaston. I'll state your name and the branch of service you represent, sir.
Gaston Dupas, and I'm Branch Army, and I'm a member of VFW Post 12065 in this area. Present I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Dupas, for your service, sir. Madam Clerk, initiate the roll call.
Tommy Pollard.
Here.
Michael Landry.
Here.
Brad Davis.
Here.
Lloyd Brown.
Here.
Warren Dotcherson.
Here.
Natalie Broussard.
Here.
Paul Landry.
Here.
James Stronha.
Here.
Scott Ronsonnet.
Here.
Eugene Olivier.
Here.
Brian Napier.
Here.
Lady Fontenette Brown.
Here.
Marty Stronha.
Here.
Chad Mathurin.
Here.
We have 14 members and a quorum. Before we get started into the public comments, I'd just like to make an announcement that I instructed the clerk as of last Wednesday to initiate an email, send out an email informing the administration and council members that we will no longer present the phone, that in order for you to be, I guess, interacting through the legislative process, you'll be here in the chambers. I'd like to welcome the parish president back and thank him for joining us. So as of now, the clerks will have the ability to do that for protection for that service, but everybody else will be back here. Mr. President, welcome back, sir.
Thank you so much. Appreciate you, sir.
Okay, we'll start with public comments. I'll need a motion to go into public comments.
Move.
I have a motion by Councilman Pollard and a second by Councilman Rossini. All those in favor signify by saying aye.
Aye.
Anybody in opposition? Hearing no opposition, we're now in public comments. Number one, Madam Clerk.
Comments from the general public on non-agenda items.
Do we have anybody? No requests? Nobody submitted? Number two, Madam Clerk.
Comments from the general public on agenda items. A, persons being considered for appointment to parish boards/commissions to address the council.
I do have one, Mr. John Simmons, that is applying for mosquito control. Mr. Simmons, step to the podium and state your name for the record, sir.
Good evening. My name is John Simmons. I'm seeking to be reappointed to the Mosquito Abatement District Board of Commissioners.
Is there any questions for Mr. Simmons?
He represents the agricultural part of the board.
Good. Thank you for that. Thank you, Mr. Simmons. Thank you
Thank
for
y'all.
being here. Mr. Gaston Dupas is here representing the Robert B. Green. You want to state your name for the record?
My name is Gaston Dupas. Okay. You need me to speak now?
Yeah, sure. Yes, sir. If you're applying for the Robert B. Green
Okay.
appointment.
All right.
Want to tell us a little bit about
My
yourself?
name is Gaston Dupas, and I serve in this area in DFW Post 12065 as the quartermaster adjutant. I also serve as the district commander for this area, for District 4 for the state of Louisiana. I work with Leslie Lander, who asked me to come and say the pledge here tonight, with the Iberia Parish Veterans Commission. Work with Mr. Fred Wesley, who is the past state commander, and Ms. Pat Wesley, who's our past state president, and they also served at national levels in the VFW. as the VFW, I'll put it short. We serve and look out for veterans. Okay, our purpose, according to our bylaws, we are fraternal, patriotic, historic, charitable, and educational. In a nutshell, we look out for the veterans in this area. If I'm being considered to serve on this board for the Robert B. Green Building, I would be honored and humbled to do that, serve in that capacity. I'm always trying to get involved with veterans, and I would look forward to serving in a way of looking out for the building, preserving the building, the use of the building, and making sure that it's done right for the veterans in this area. Okay, and that's all I have.
Are there any questions for Mr. Dupas?
Thank you.
Hearing none, thank you for your service, sir.
Thank you.
All right, one last call. Is there anyone else that wants to address the council on any agenda item tonight? Mr. Dupas?
I got one alibi. I also work with Mr. Spencer in this area, okay? And this guy right here helped us out a lot, okay? Thank you.
Good to hear. Thank you for your service again. All right, hearing no others that want to address the council, I'll need a motion to go back into regular session. I have a motion by Councilmember Michael Landry, a second by Councilwoman Natalie Broussard. Hearing no discussion, roll call. Those in favor will signify by saying aye. Aye. Anybody in opposition? Hearing none, the ayes have it. That motion carries unanimously. We're now back into public comments. Reports, finance, and administrative actions. There are none. Reports on parish or other government agencies. Madam Clerk.
Number 1, monthly building report dated February 2021.
I believe that was,
And
go ahead, I'm sorry, Madam Clerk.
number 2, Ms. Dion Viatar, CEO of Iberia Medical Center, to present the audit of financial statements of Hospital Service District Number 1 of Iberia Parish, fiscal year 2020.
I believe number 1 was put into your packets. Number 2, I welcome Iberia Medical Center. Want to state your name for the record?
Dion Viator. Thank you, Chairman and Council. Appreciate you hearing from us tonight. We're here to present our September 30th, 2020 financial statements, but I'd like to use the opportunity as well to talk a little bit about some of what we've accomplished this year, the financial statements, and then some of what we plan to accomplish next year. With me here is Amy Longlinay, the VP of Finance for Iberia Medical Center. She's been with Iberia Medical Center for quite a while and wanted her to participate in this program with us because she's actually the one who has done most of the work that I get to present tonight. So if there are further questions, she'll join us as well. But I'll go ahead and start. With Iberia Medical Center, of course, your community hospital, it's easier to say some of the services we don't do than it is to list all of the services we do. We're full service. The things that we don't do is open heart surgery, brain surgery, and we don't have a neonatal NICU or a pediatric ICU. But other than that, full service. The only other difference here on this slide from what I've shown you in the past is we are a 166-bed acute care hospital. Last time we spoke, we were 146. We've added 20 beds, and I'll talk a little bit about that in just a minute. This is COVID-19. We're a year into that now. Amy started tracking this on a daily basis for us, and now we've got a slide that's this long and a lot. It looks confusing, but what this is the last year. On the left-hand side, you see our census. We peaked at 32 patients in July. The red bar is patients in our medical unit floor. The blue is patients in the ICU. So you can see that we have had some peaks. We've learned to manage the COVID disease process. And I've put 2 blue stars up there because that is for the only 2 times for 2 days apiece we had 0 patients in-house. We celebrated on those days. Today we have 6 patients in-house, 1 in the ICU, but no one on vents. So doing well. You know, COVID has been for us quite a few phases that we've gone through. We started back a year ago with, of course, identification of the disease, learning about it, and then doing the screening. We did a lot of public screenings, and we had, I show this slide to just let you know the different places that we were able to go, and really that our physicians who volunteered. Many of their clinics in the beginning were closed during the day, and so they were volunteering to help the community in any way that they could. Next, we moved from screening, continued screening, but more to education. We started talking about how do we get students back in schools and things like that. So I just want to compliment the Iberia Parish school system and Carrie Laviolette, because they were tremendous to work with. We arranged, as they were preparing to reopen, for Dr. Moses Chitakuli to get all of the school nurses, the administrators, and any of the faculty that wanted to participate in a webinar that was a Q&A session. How do we recognize it? How do we distance? What are some things that we need to do to prevent this? So with hospital resources, we were able to print a lot of the CDC guidelines and work with them on some of the rules surrounding that, and then had follow-up calls. We also got all of the nursing homes in the area on the line with Dr. Chitakuli and WebNext. So we had the medical directors of the nursing homes. Because the treatment of COVID changed so quickly. What are the early signs to see? What can you manage in the nursing home? What do you look for? When is it time to move the patient to the hospital? What resources do you have? Do you need? How can we share? So that was an earlier stages and successful under the leadership of the physicians that we have here in this community. Again, we talked about Dr. Chitakuli. And the protocols. He worked with Dr. Sun Nguyen, our chief of medicine, and they developed protocols. And as a medical staff, we met almost weekly. Every Monday night at 5:30, we would talk. They would talk about worldwide what was going on with COVID, what the change in protocols were. The medical staff would come to agreement with that. There were written protocols that all went into place to make sure that every patient was maximized with the latest technology. So we have that here with his articles that have been written on him, a couple that survived. And then I have here, the picture in the middle is just the community outpouring to Iberia Medical Center was tremendous. We had Representatives Boyer and Bryant coordinate meals for our caregivers. Of course, in the early stages, the restaurants were closed, and there was a lot of fear about COVID and how to move forward. So the community in general, bringing us food, donating supplies, the outpouring was tremendous. And as a part of that, our medical staff led us really to cutting-edge COVID-19 treatment. There is nothing that here in Iberia Parish we didn't have that you wouldn't get nationally. We had the monoclonal antibody infusion treatment therapy. We still do. What is that? That is antibodies that are made in a lab that when you are early on with minimal symptoms of COVID in high-risk categories, you come to the hospital and we do a 1-hour infusion. And so there's a lot of information that we need to get out. You need to catch that early, and we provide that on a daily basis at the hospital. We also worked with Mayo Clinic in a clinical trial, again trying to use antibodies to fight COVID for people who had recovered from COVID, using blood that they had donated in transfusions for inpatients to be able to work with the patients there with tremendous success. Then we moved into the next phase, and this was the vaccine phase, the phase that now gives us all hope. So first the healthcare workers, and just thrilled with the way that the vaccine is now rolling out to more and more communities. We get a weekly allocation. We don't always know what that's going to be, but we have not, every week we get our allocation, we give out the full allocation, and we've not wasted one dose. We've been able to, on a few occasions, be able to leave the hospital proper. Much of the vaccine allocation we get has a very complicated handling process with sub-zero temperatures and things like that. We do that at the main campus. But when we get some of the other brands of vaccine, other vendors that do have just refrigeration needs and some things that are easier to work with, we've been able to take our show on the road, work with Louisiana Department of Health at the Sugarina, do a vaccine event in Generette and at Nish for the teachers. At this point, we have vaccinated every Iberia Parish School System employee that wants the vaccine. We've covered them now, so very pleased about that. Moving forward here, we have someone who met the criteria for vaccination, and wanted to make sure I gave a shout out here because we truly appreciate the parish's leadership. We seem to be turning a corner here, and from the beginning, the leadership that Larry has had and this council with messaging, mask wearing, with messaging, social distancing, has really helped us kind of move forward with this. In addition, whenever we have sought locations to go off-site to be able to either do the testing or the vaccines now, when I would call Larry, the answer was just yes. What do you need? Yes. Helping with location, helping with arranging security for the areas, traffic assistance, whatever needed to be done, the answer was just yes. And I can't go in talking about the last year without saying, in addition to COVID, we had a couple of hurricanes and a polar vortex. So with that, I have never been involved with a parish that communicated in a disaster like this one does. So again, just a shout out to your parish leadership and Larry in particular, that just brings everybody to the table, communicates and over communicates to make sure we all know what each other is doing, what resources we have, and how we need to help each other. So that's tremendously important, and I think a critical part of why through all of these emergencies that we've had lately, Iberia Medical Center, we kept our power, we kept our water supply, we kept everything that we needed to do, and we all knew where each other stood in that part of that process. We also, I have to give credit to our hospital board, who approved quite a bit of infrastructure improvements in the past year. As you know, it's been presented at this council before. We've had some issues with roof leakage and some things like that. Let me go through a few things, just fixing the infrastructure at the building that has gone on over the course of the past 12 months or so. We have a new roof on the main campus. That was a $2 million roof, and we have completed that installation completely now. No issues at all. We have a new emergency generator. That gives us 2 fully functioning generators to back up at both campuses now. So in good shape there. We put an enhanced security system in place at the main campus. We've changed out all of the lighting in the parking lot to LED, and we've moved forward for just safety of patients, for visitors, and for our employees with that as well. Other improvements, we have new cooling towers, we have new deaerators. A deaerator tank is a tank that removes all of the oxygen and contaminants out of the water that goes into our boilers and chillers to prevent the contamination. It's here not because it's fancy or sexy. It's just something that really will help us take the investments we've made today and make them last like they need to a good 20 years. We've added a new water booster pump, which, hallelujah, it has paid for itself 3 times over with this last event that we had, kept our pressure where it needed to be to continue all patient care during the course of that ice event. We've done medical air upgrade and some HVAC and chiller upgrades as well. As far as state-of-the-art equipment, all of our money has not gone just into the facility infrastructure hardening. We've gotten some state-of-the-art equipment with all new orthopedic power tools, new surgical C-arm, which that is an x-ray that is used by surgeons in the OR to be able to see real time while they're in surgery. We've gotten new portable ultrasounds, some giraffe bed warmer for our infants, and then the pharmacy sterile room. That is a room that is meets the highest qualities, the highest standards of the pharmacy board, with pharmacists going in there to be able to mix chemotherapy drugs and other things in a way that there's no contaminants, safe for the employee, and just very sanitary and safe for the patient administration as well. We also, over the course of the past year, have added the state-of-the-art technology with robotics, with the Mako certified hip replacement, knee replacement, and partial knee replacement. The community reception to this has been tremendous. We are finding quite a few patients that used to leave the market thinking they needed to leave the market to get the cutting-edge technology, now staying with us. We have 3 surgeons here in Iberia Parish that are certified with this robotic technology. Dr. Sinak, Dr. Lasecki, and Dr. Rosenzweig all are having excellent outcomes with this robot. Also, meeting community needs in addition to what we've purchased and invested in, we've invested in our physicians. We have recruited 3 new physicians so far this year. Dr. Rastogi is the one to the far left. He is a cardiologist, interventional cardiologist. We have Dr. Danielle Cobb, who's a general surgeon, and Ronald Hebert. He goes by Tyler. Tyler Hebert starts in family medicine, family practice here in this community in September of 2021. So just a few months from now, he'll be joining Dr. Mata Kuzan Menard's group. So we look forward to having him expand services in Iberia Parish as well. We've also taken the opportunity over the course of the last year to focus on the community. How do we do that? We try to do it through outreach with some of the testing and the vaccine and everything that we're trying to do, but we also know that we need a healthy workforce. We need the Iberia Parish to be a healthy place to work and live. So we've been reaching out to employers and going and educating on the workforce about health, wellness, injury prevention, going out and doing blood pressure checks, doing flu vaccines, and everything else that some of the employers here in the community would like as a part of their healthy workforce. So that's where we've been in the course of the past year. I'll stop and see if there's any questions, and then I'll roll into the financial results for the year.
Do we have any questions for Ms. Viator? Hearing none, Ms. Viator, if you want to close.
So this is BKD has performed the audit of Iberia Medical Center. This is a slide. Any of the slides where I have the red BKD in the corner, that is a slide that they prepared. So this is just one indicating that they issued a clean opinion. They looked at all of our accounting policies. They made sure we followed generally accepted accounting principles. They made sure all of our financial statement disclosures were complete and accurate. They looked at all of the estimates to make sure that they were also reasonable. They disclosed that they had no concerns, difficulties, or disagreements as a part of their audit. We have a balance sheet I know most of you have received, or all of you should have received in your packet, a complete set of the financials, but I'll do a quick snapshot of the balance sheet and the statement of revenue and expenses. Didn't know if I'd have a pointer here tonight, so I put a little blue star by the side of the items that I'd like to talk a little bit about. The first line there with the blue star is cash and short-term investments. You can see our cash went up about $25 million between 2019 and 2020. That's a really good indicator. However, $16 million of that is money that Medicare gave us in advance. It's a loan. They knew that there would be trouble with healthcare providers and COVID and trying to bill and collect for things because they didn't even have codes for us to bill and collect on it for. So they advanced hospitals money. We were advanced $16 million. We were able to work our cash flow where we didn't have to use it, so we've put it aside. It'll be repaid over the course of the next 12 months to the CMS, so that's not ours to use, and we've just put it aside. The other is we've applied for and received CARES Act funding of about $6 million. In fiscal year 2020, we got it late in fiscal year 2020. We spent about $1.3 million of that in 2020. So the other $5 million of it has rolled into our fiscal year 2021. So that's what the cash item is there. And then what you'll see in the next 2 stars is where we have the liability back on our books to pay some of that back. And the last star there says net pension liability. Last year we had an obligation of almost $21 million, and you can see the significant reduction there. You know here the pension liability swings from year to year, and the assets within the pension plan performed very poorly in 2019 and rebounded in 2020, causing the swings back and forth that we have there. That was not a cash impact item, and doesn't hit the income statement either. That's just the accounting, GASB 68 accounting requirements there. On the income statement, we had a total profit for the year of $3.8 million. We had our revenue stream. You can see the top line, net patient service revenue was flat with last year. However, other revenue, some of the value-based purchasing and other quality improvement payments that we were able to receive were in the other revenue line item. Salaries, wages, and benefits are down by almost $5 million. That is a reduction in the pension plan expense for the most part. Professional fees and purchase services increased significantly. This was because of the shifting of our volume from lulls to high capacity needs and our contract labor that we had in that line item for the most part. And then supplies and other expenses increased. We all heard for months on the news, it's PPE and the high cost of a lot of the PPE and the high cost of some of the pharmaceuticals that we needed to treat COVID were in that line item. So with all of that in balance, a lot of the drug cost and PPE was covered by the provider relief funds of $1.3 million, resulting in an overall net bottom line of $3.8 million. This is our total revenue trended over the years. You can see that the increase that occurred significantly after the Dotrieve campus was taken on by Iberia Medical Center. And this is just a slide on the CARES Act funding. This was one provided by BKD, and we got a laugh about it. This is a summary of our funding that we've received, the Medicare advance payments. That's the almost $15 million that we do need to pay back. The provider relief funds that we will not pay back, we'll be able to use those for the community benefit of caring for COVID patients, doing some of the screenings, vaccines, and everything that we're doing as a part of this year. And then that bottom slide that BKD put together really was a timeline of when the federal government announced it, and then all of the different changes that they've made along the way to the requirements for using of the money. So it is seems like every few weeks they're changing the requirements, they're changing the rules to the game, and we're attempting to stay on top of all of that and continue to apply for any other provider relief funds that become available. What's important to us moving forward is becoming a provider of choice in this community, listening to our patients. So this is a trend of our ED patient satisfaction over the course of the last 6 years. We're listening to our patients and we're trying to respond. So this is going to be one that we're very focused on as a management team. Also moving forward in the course of the next year, emergency room. We know our main campus emergency room is crowded. And so we are looking at evaluating a North Campus emergency room. We are more than just in the planning phases. We are in the detailed implementation phases. We will be bringing to our board in the course of the next couple of months, requesting for them to approve us going out for bid for some construction that needs to happen to have that work for us. The why behind that is to improve community access to care and wait times to remove some of the congestion that we have at the main campus. In addition, we've invested and going to continue to invest in more ventilators this year. And make the negative pressure air that we did in temporary units over the course of the last year. Right now we're undergoing construction to make the negative air pressure capability within the hospital permanent, so that we'll be prepared as this evolves. The other thing I have here on the bottom right is mentioning again the addition of 20 medical surgical licensed beds at the main campus. So on the third floor of the main campus, we've redesigned an area. We have 20 additional beds, again, to help relieve the emergency room with some of its holds and capacity issues. And we are looking at moving forward. They moved into it this week, so we're moving forward with staffing that and hope to continue to treat more patients in that area as well. Again, in this year, we've again done the roof at the main campus. We are looking at the north campus, a partial roof replacement. Inpatient beds, replacing about half of our beds at the main campus. And also moving forward with a strategy of early cancer detection and treatment for this community. We have quite a few components to this. We have Dr. Constantino, who is excellent in this community, but just one physician. We are recruiting a second medical oncologist, hopefully to start in this 2021 and partner with him. We have purchased and installing 3D mammography that has the ability for early detection and biopsy of any lesions that are found there. And we are also installing Philips enhanced radiology archiving. So this is for all radiology procedures, for all cardiac procedures, for the radiologist to use, and it has embedded in it artificial intelligence. So we really are trying to move forward with early detection and treatment of cancer. That is all I had as a part of my report, and I would appreciate any questions I could respond to.
We do, Ms. Viator. Councilman Napier?
Ms. Viator, excellent presentation. I want to tell you that really looks good. Since you've been there, things have changed, at least in my eyes, at the hospital. And I want to give you a big thank you. And y'all on a great road right here. Keep it up. Iberia Parish needs it. So I just want to tell you thank you for the presentation. It was excellent, and keep up the good work.
Well, thank you for your time, and it takes a team. We have so many people at the hospital that just needed to be cut loose to let their talent shine.
Great.
You finished,
Good
Mr.
job.
Napier?
Yes, thank you, Mr. Chairman.
Ms. Viator, I do have a question for you, and I get this often in the community about the North Campus, maybe possibly a ER, maybe another add-on. I know, not long down the road, I think the board had kind of approved some money for y'all to do a study on that, correct?
Yes.
Where are we with that?
For the emergency room study,
Correct.
the board approved us to do a study. We worked with that with a consultant to look at the out-migration that was happening. We looked at a history and trend that in Iberia Parish, residents with a zip code in this parish leaving the parish for emergency services. That came out favorable to move forward. Then we had an architect look at what it would take to move us forward from a construction standpoint. Doesn't look like it is insurmountable at all. That ED is in really pretty good shape,
Okay.
And it hasn't been licensed for a while, so it has to meet current code. And we are going to move forward with asking them to go out to bid in the next meeting or so as the architects finish their more detailed design to be ready to put a packet together.
Good.
There are some things with ADA and other things that it doesn't meet current code, but I think it's very doable within the current space and could, by the end of this year, if we can go through the licensing, either through the end of 2021 or the beginning of 2022, have another access point and option for the community.
Good. Anyone else? Here are no other questions. Thank you for being here. Oh, I'm sorry.
The wait time at the ER on the South Campus versus adding the North, what will it do? Will it balance or will it?
Well, I'd love to, if my crystal ball was clear on that, hopefully what's happening is it will also keep people from driving
Away.
outside of the parish and come within the parish. I think that the wait time is going to be impacted by a couple of things at the main campus. One is trying to move patients that are currently staying in the emergency room a long time in the new 20-bed unit that we have, freeing them up to provide additional care within that unit, and then also opening the other campus for treatment as well. Our goal is to have, from the time someone presents in the emergency room to being seen by a provider within 30 minutes.
Great.
Councilman Rawson, you done?
Thank you. That's it. Thank
President Reshore?
I just want to say thank you to you and to the staff for everything that you do for Iberia Parish. It's been a pleasure to work with you over the last, I can't even tell you how long. It seemed like the last year we've been working with this COVID issue. Dion has certainly been on the phone calls with us twice a week or as needed, providing information to not only Iberia Parish, but to other hospitals and physicians and people throughout this region. It's been an unbelievable experience just to be able to contact you, text you like I did earlier today, and you simply just text right back or call right back. The relationship is very good. We in Iberia Parish, we welcome that. We welcome your staff and your board. So I just want to tell you thank you so much from the administration, and hopefully on behalf of the Iberia Parish Council, we want to say thank you to you and your staff for everything that you did.
Thank you, and I appreciate your leadership, and we're here to support, so.
Thank you.
President Richard, you finish?
Thank you, yes, sir.
Thank you for being here. Moving on to Public Works reports.
It's obvious they stay pretty busy, and I had hoped that the resolution to be adopted was gonna be on the consent agenda, but
It's
it
not.
happens to be the last item on the agenda. I just wanna make sure
Yeah.
there's no reason for them to stay.
If you'd like, I mean, we can move directly to that and pass it before they leave.
That would be
If there's
great.
if there's no objection with the council. We'll go to summary number 45, introduced by legal counsel. Madam Clerk.
A resolution to acknowledge receipt of the 2020 fiscal year audit of the financial statements of Hospital Service District Number 1 of Iberia Parish, Iberia Medical Center, to provide for the effective date thereof, and to otherwise provide with respect thereto.
Do I have a motion? I have a motion by Councilman Rossini and a second by Councilman Olivier. Councilman Rossini? Councilman Rossini waves. Councilman Olivier waves. Is there any discussion? Hearing no discussion. Roll call. Those in favor will signify by saying aye. Aye. Is there anyone in opposition? Hearing no opposition. The ayes have it unanimously. That motion passes. Congratulations. Going back to reports, Parish or other, reports from finance and administrative actions. There are none. Reports from Parish or other government agencies. I think we just did that. Public Works reports. Number 1, Madam Clerk.
Public Works Department report for closed work orders dated February 10th through 23rd, 2021.
You should have received that by email, members. Next special business, there is none. Council member announcements. I do have an announcement from Mr. Olivier. You are recognized.
I'd like to remind everyone that the NACO 2021 Virtual Legislative Conference is currently going on through the rest of this month through March the 26th. NACO is and the State Association is very instrumental in influencing policies in Washington as well as in Baton Rouge. You can see some of the things that NACO is involved with the American Rescue Plan Act of 2021. I think that what you're going to see is that the benefits that these organizations play in these funding packages coming out of Washington. Thank you very much.
Councilman Olivier reserves. Councilman Brown is recognized.
Yes, I just want to remind all the senior citizens that the distribution of the 4% senior citizen was canceled last month, and we're going to start that this month, issuing the food to all the qualified senior citizen on the third Wednesday, which is the 17th, in Iberia Parish. The distribution in New Iberia would be in West End, in Jeanerette, and Lafayette. And also want to say that as of this date, that I have been fully vaccinated for COVID.
Congratulations, Mr. Brown.
Thank God.
Congratulations. Mr. Brown, are you finished?
Yes.
Mr. Brown reserves. Is there any other council member announcements? Mr. Michael Landry is recognized.
To piggyback on Councilman Brown, today I was fully vaccinated. So-
Congratulations, Mr. Landry. Anyone else? Mr. Landry reserves. Hearing no one else. Next is the parish president announcements. President Richard, you're recognized.
Thank you so much. I'm going to give the last 2 weeks of work from Public Works. Cleaning culverts in District 6, District 7, 10, and 14. Culvert inspections in District 9. Debris pickup in District 1, 2, 3, 8, 9, 10, 12, 13, and 14. We had trees down in District 10 and 12. Field drainage work was done in District 5 and 10. Roadside drainage work was done in District 2, 9, 11, and 14. We did some road grading in District 9, 10, 13, and 14. We had some limestone work that needed to be done in District 8, 9, and 12. Road patching in District 2, 3, 5, 8, 9, 10, 11, 12, 13, and 14. Field drainage or field ditch side booming work was done in District 12, and shoulder work was done in District 10 and 5. This morning we had a meeting at 10 o'clock here for a pre-bid construction meeting for the People's Coulee project. We had about 10 vendors here, and we had a lot of discussion. The bid date for that project is on March the 31st at 10 o'clock, and bids are going to be opened here in the chambers at 10 o'clock on March the 31st. I'm going to give a quick COVID update. I know Sion did one just now, but I'm going to talk about the region. In particular, in the region we have right now, the numbers are going down big time. We have 56 people admitted in hospitals right now in the region, the 7 parish region. We have 7 people on vents in the whole region. At Iberia Medical, you heard earlier that we only have 6 people admitted in the hospital with 0 on ventilations. I'm very, very glad to see the parish council members wearing their masks. We need to continue to wear our masks. We need to continue to wear face covering, if not a mask. Do your social distancing. Wash your hands as often as you possibly can. And let's continue to work together to try to get this virus behind us. In reference to the Sugarcane Festival building, we're on schedule to have the facility return back to the condition it was in prior to the being vandalized. And we hope to have all of this accomplished by March the 27th. We're currently taking bookings for the building at this time. All bookings for the Sugarcane Festival building is going to Cindy Provost at this time. So if anyone want to do any bookings, just simply call 365-8246, and at this particular time it's going to Cindy Provost. The council recently passed a resolution asking the state legislature to enact legislation investing in and facilitating the installation of high-speed internet service to the underserved and rural areas of the state of Louisiana, which includes Iberia Parish. It is reported that $300 million will be used for the underserved areas, and $3.2 billion will be used to reimburse households for internet services during the pandemic to get access to the providers. In addition to that, the United States Department of Commerce, DEA, awarded $3.1 million grant to LUS Fiber. This is a partnership with LUS and the Acadiana Planning Commission for the development and construction of broadband infrastructure into rural southwest Louisiana. The resolution and the grant has brought very good conversations with Iberia Parish government, Iberia Parish Council, the providers, and many other people in this area. We need to have these types of conversations. I welcome the conversations. In fact, next week I'm having meetings with 3 of the providers, and we certainly need to try to do whatever it is that we can do. I know, Marty, you're constantly calling me about services. Chad, I got one from you last week. I get them from all of the parish council, and we've been going through this for many, many years. In fact, we've been going through this since I was a councilman for over 10 years. We've been going through this, longer than that. So I think right now we're having the discussion that we need to have when it comes to high-speed services in Iberia Parish. Any questions or comments from anyone for me?
Do we have a question for the President Richard?
I
Mr.
do.
Napier, you're recognized.
Mr. Richard, last meeting, I brought up a issue about, trash in District 11, which it's not just in District 11. It's all over.
Right.
And it's most of it. It's not at at someone's house or someone's property. A lot of it's on the side of the road. And we talked about it, and I'm gonna be honest with you, in the last 2 weeks, I haven't seen anything done about it. I had Brenda send another email out asking, first I'd asked, what's the procedure? I don't think we ever got to that, but it's still there, Larry. It's building. Even some of the spots, they starting to throw stuff because there's something there. Right. So there's mattresses, there's furniture. I know, I see it. So I know the administration sees it.
As well.
I know the public works sees it. All I'm asking is, what are we going to do about it? It's not just in my district, it's all over the parish, and it's getting worse, and it's not being picked up, whether it's Waste Connections, whether it's us. I'm asking you tonight,
Okay.
what are we gonna do about
I
it
think-
and when?
I think the conversation that you and I had was a very good conversation, a start of something that needs to be done in Iberia Parish. I think that we need to have a location where people in Iberia Parish can actually have to bring their debris. We don't want to call it bulky waste, their mattresses and things of that nature. You know, we have, Paul, of course, for a few years now, we've actually been looking for that. I think the first year you became the chairman of the parish council. And I gave it to you, Brian, because I want you to do exactly that. And I asked you to try to get a committee set up, because this is not something that Public Works can just say right around the parish and pick up bulky waste. There is a schedule for it. And we do get the bulky waste picked up by Public Works and by our Waste Connections. In fact, we've had meetings with the district attorney, meetings with the sheriff. We're trying right now to come up with a schedule. We're using, if you remember, prior to COVID coming here, we were using people that had community service, and we was going once every week and meeting at the Public Works Department and picking different roads throughout the parish, and it was helping. We haven't done that in a year. And you can tell that you haven't done that in a year, because those bulky waste areas are starting to escalate. The sheriff and the, I'm trying to think about when we said we was going to start. I think we're hoping to start at the end of April. Of course, we're going to have to do things different now until this COVID thing is all the way behind us. We will not be able to, and I'm talking about starting at the end of April with the community service people. Typically, the way it worked in the past is all the people that had to do community service would drive to the Public Works, and we would get in a couple of vehicles and we would ride, and they would go out and pick up. We can't do that now because of
Talking about
COVID.
the litter
So-
abatement?
The litter abatement program, yes, sir. So what they're gonna have to do now is we're gonna pick the location, and they're gonna drive to that location, park their vehicle, and we'll do one side of the road and come back. But seriously, Brian, to solve the problem that you're talking about in Iberia Parish, I don't think we're gonna solve that problem until we have a place for people to bring their trash.
I agree with you. And Warren and I have talked about that committee, but that's not something that's gonna happen this year.
Right, I
You know,
agree with that
hopefully
too.
we can get the ball rolling. What I'm asking is the stuff that's sitting in the ditch, that's also a drainage issue.
That's a big
also.
drainage issue.
We got, this time of the year with rain and if we
It's a
get
huge
some
issue.
flooding like we got in 16, it could be a problem. We got hurricane season coming up. I'm asking, are we gonna wait till we find a landfill before we get this picked up?
We've never done that.
No.
Go ahead, I'm sorry, go ahead.
No,
Keep
no,
on
no.
talking.
And all I'm asking is because, Mr. Richard, I'm getting calls and I'm trying to figure out how to answer them, because, I'm bringing it, I mean, I can't call Public Works and tell them go.
But you can call Brendan.
I have.
Okay.
The
And just
thing
turn-
is,
just turn in the address, don't-
I'm just asking, the things that's just alongside the road ditches, I mean, and it's not just trash. It's big stuff. It's mattresses. I know you've seen it, so, I mean, we've all seen it. So I'm just asking you tonight, do we have a plan, immediate plan, to get that picked up in the near future? Because it's not like this has been for a couple months at least, it's been there, and I'd like to
I
be
can
able to
tell you-
answer that question, when we gonna pick that
I'd
up, or
like to tell
who's
you what's
gonna
going
pick
on.
it
I'd like
up?
to tell you if you give me an opportunity. All of that particular, when you're talking about picking up debris, for the most part, all of that, or bulky waste, all of that is going to come from Public Works. In Public Works, we have a total of 21 people for the parish. Currently in Public Works, a whole lot of things have taken place, and I don't want to get into personnel problems, but right now we have people out because of various things that's taken place in Public Works. A lot of things have to do with COVID. But we will always, and we have always in the past, used Public Works to pick up, as well as our contractor to pick up. Now, what I would recommend, and what I try to tell people to do when they call me, is give me that number, give me an address, give me a location, and turn it in, and we can try to pick it up like that. But we simply, and you would probably know that, We simply don't have the people in Iberia Parish that work for Iberia Parish government to go around picking up bulky waste. I mean, if you would take your whole public works department and send them there, you can't do that. So it's going to have a lot to do, Brian, with the people that's just riding around, I guess, because if you're throwing it in areas that's not in front of an address, you read the contract with Waste Connection. So you know, or you should know, that if it's not where an address is, they're not going to stop and pick that stuff up. So that means we have to get Public Works to do that. Now, every time I take Public Works away from the few people, you know how many people we got doing what we do. So I think that we're doing the best we can do until we actually get more money, get more people hired, come up with a solution. I think the solution for Iberia Parish long term is to have a couple of things in place. Number one is to have a landfill in place and have to have drop-off points in place where people can drop off things that they have. So that's what we're working on right now. So the short-term solution or the short-term goal is to have drop-off points. So we are in communications right now with Waste Connection for that. The long-term solution is to come up with a landfill where we can actually have people bring their big items there.
So I agree, Larry, I agree with you.
Thank you.
I do. I just, I don't think I got an answer yet about what's there now. What is Public Works going to eventually get to it?
No, what's there now, give us an address and we'll go pick it up.
Larry, there's no address.
Well, what am I supposed to do? There's no, just say,
I
don't
tell
do
you
your
what,
job
you
today?
get, I'll come pick you up.
I would
and
love that.
And I'll go show you each point.
Yeah, do
They
that.
just
Yeah.
in the
That's what you're
ditch
gonna have to do.
alongside the road, easily seen. Easily seen.
Right,
All
okay,
right,
good, thank you.
I'm gonna leave it alone. I wanted to look, people are asking me, you the administrator, I'm asking you, so.
And I tell you what, if we find the locations, we'll pick it up, Brian, because certainly we don't want anything in a ditch.
Well,
Because that's gonna
where
create
they
more
at.
of a problem
That's
for
where
Iberia
they at.
Parish.
Thank you, Mr. President.
Thank you, sir.
Councilman Neighbor, your reserves. Any other questions
Hold on
for
a
the
second.
President Richard?
No,
Scott, you're-
Brian just said it. The answer is what you just said. I do it with Eugene all the time. Matter of fact, I hadn't heard
Let me
from
know
him
when-
for 3 months. He called me today. I knew exactly what he wanted. You can't say your whole district. So if you would, Brian, just call one of us tomorrow. We'll do exactly
ride
what you
with
just
you.
said. We'll come and mark the spots. Because
And
Larry's
get-
right,
and
we're
get it picked
shorthanded.
up.
So if we know exactly where they're at, it's easier for us to address it that way. I hear what you're saying.
And what he's saying is true, is
Yeah.
real,
Oh, it's definitely true.
is real. Thank you, Brian.
Thank
Anyone
you.
else have a question? Mr. Mathurin is recognized.
A question for Larry. I'm not sure if, I heard an announcement today, Cassidy and Higgins, 2.1 million and some change appropriated for, I think it was 15 structures in Iberia to be lifted. Do you have any info on
Yes.
that?
Yes, you talking about the homes, the elevation of the homes? Yes, we actually, we don't have the official deal yet. So Senator Cassidy and Senator Kennedy and probably Congressman Higgins is actually throwing the number around. I will not give the number out until I actually get the real deal. But I have got a number that's being used. It's actually in Iberia Parish, it's 15 homes.
Is that
but
the program that
that's
was
a-
at the
that's
slime
mitigate-
that we?
Exactly. You actually have homes in your area. I
Right.
looked at it, you have it in
So-
your area.
So it's actually taking place for
It's
some of
taking
that
place
stuff.
as we speak. Hopefully by Friday, I will be able to send a letter out to the council clerk telling her that everything is done. I hope by Friday. I'm not
No,
saying we
I
will
was
by
just
Friday.
curious. I
But
saw the
that's-
statement
that's all
today, and
real,
I was
yeah.
just curious. See what info you had on.
So that's a big deal for us. We've been working on that for, as you know, for quite some time.
Right, yeah.
And so to get those 15 homes in Iberia Parish, that's a very big deal. And let me see, I'm trying to look for something as we.
No, that's good. I
that's a
was
very
curious.
big
I
deal.
saw it come out today, and I was just curious about it. Then to see if it was part of that program that we had. I think there's the last 2 years that it's good to see us moving
Right,
forward.
and what I'm going to do is when we get everything squared away, I'm going to get the company that we, that's actually doing the engineering work or the work for us, which is QES, to come here and do a quick presentation during one of my parish president announcements.
Okay, thanks. Appreciate it.
Thank you.
Councilman Mathurin, reserves. Anyone else? Hearing no other questions? Moving on to the consent agenda items for public hearing and adoption. Madam Clerk?
Minutes, regular meeting of February 24th, 2021. Summary number 38, introduced by the parish president. A resolution amending the 2021 General Fund and HUD Voucher Fund budgets to recognize remaining CARES Act funding in the amount of $6,700 to be expended on part-time salaries and related benefits, $4,200, supplies, $500, and equipment, $2,000. Summary number 39, introduced by the Parish President, a resolution amending the 2021 LCBDG fund budget in the amount of $1,408,365 to reflect carryover project awards for PERP ARA Access Road Project. Summary number 40, introduced by the Parish President, a resolution amending the 2021 General Fund, Road District Number 10 Fund, and Public Building Maintenance Fund budgets in the total amount of $250,000 to recognize state funding for parish boundary signs, trailers, and striping machines, and improvements to courthouse building location. Summary number 41, introduced by the Clerk of the Council, a resolution of condolences to the family of Mr. Charles Peter Derwan, father of Iberia Parish Registrar of Voters, Ms. Christy Blanchard, who passed away on February 24th, 2021.
Do I have a motion? Have a motion by Councilman Paul Landry and a second by Councilman Tommy Pollitt. Mr. Landry? Waive. Mr. Landry waives. Mr. Pollitt? Waive. Mr. Pollitt waives. At this time, does anyone care to take a agenda item out of the consent agenda? Hearing none. Is there any discussion on any agenda item? Okay. Here we go. Roll call. Those in favor will signify by saying aye. Aye. Anyone in opposition? Hearing no opposition, the ayes have it. The motion carries unanimously. Moving on to ordinances introduced for public hearing and adoption. Summary number 5102, introduced by the Regional Planning Zoning Commission. Madam Clerk.
An ordinance approving a special/conditional use permit to allow a daiquiri and cold cup business in an A1 agricultural zoning district located at 4910 East Admiral Drive, located in District 10. All is reviewed and recommended by the Iberia Parish Regional Planning Commission.
Do I have a motion? Move. I have a motion by Councilman Olivier. Second. And a second by Councilman Michael Landry. Councilman Olivier? Councilman Olivier waives. Councilman Landry waives. Reed Boudreaux, if you want to step up to the mic, tell us a little bit about it, just for the record, and those watching.
The applicant would like to open a daiquiri stand. The location that we're discussing is the intersection, near the intersection of Dornell Road and Admiral Dauto. It's maybe a quarter mile this way from there.
Put the podium on.
It's zoned as agricultural. The ideal case, it would be zoned commercial. However, she's leasing the property, so the owner doesn't want to permanently rezone the property. So the other solution is a conditional use permit. Is basically the same thing, except just permission for her particular business. I see it's actually a lot of traffic there. I think it'd be a great location for a business like this. So.
Is there any questions for Mr. Boudreaux? Hearing no questions for Mr. Boudreaux, is there any discussion on the agenda item? Hearing no discussion, we'll roll call. Those in favor will signify by saying aye. Aye. Is there any opposition? Hearing no opposition, the ayes have it. That motion carries unanimously. Resolutions introduced for public hearing and adoption. Summary number 42, introduced by Natalie Broussard, District 6. Madam Clerk.
A resolution amending resolution number 2017-179, adopted September 27th, 2017, which amended the 2017 general fund budget in the amount of $15,351 to provide emergency funding for the Iberia Parish Community Emergency Response Team, CERT, in order to increase that amount to $20,000 for funding CERT for emergency shelter and or evacuation needs, materials and supplies, training materials, shelter kits, and repairs and maintenance, all to be funded from the 2021 general fund budget fund balance reserved for emergencies line item, and further requesting that the administration notify the council when the balance drops between $10,000 in order for the council to consider appropriating additional funds.
Do I have a motion? Move. I have a motion by Councilwoman Broussard and a second by Councilman Trahan. Madam, Ms. Broussard?
Yeah, Andy, I just want to make sure that this resolution, as it's written, is clear, that it took out the requirement that it has to be declared a state of emergency by the parish president.
look at the actual draft that's in your packet to make sure.
While Andy's doing that, Natalie, if you would reserve for a second, is there any other discussion on the agenda item while he's doing that? Mr. Trahon, you was the second. Did you have any discussion?
No.
Mr. Trahon, wave. Councilwoman Brown is recognized.
Yeah, so, well, to follow up to Natalie's statement, so the 20,000, you're saying that the parish president wouldn't have to declare an emergency for it to be utilized?
The woman has stated a question, Madam Broussard.
Yeah, that is correct. Under the previous resolution, we only had access, CERT only had access to the funds after the parish president declared the parish to be in a state of emergency. This would allow CERT to have access to the funds year-round if we're doing some kind of training, if we need some kind of supplies. We have a trailer, we have a generator. If we need to do some kind of repairs to something, we don't have to wait for a state of emergency to get what's needed.
Okay, so who would determine if it's an emergency at that point?
It's not an emergency. It would be
It's just for
It would be for
repairs?
emergency preparedness.
Oh, okay. Oh, okay, for emergency preparedness.
Yes.
Okay.
Just to clarify, the parish president still have to approve that expenditure, correct?
It goes through the Office of Emergency
Emergency
Management.
management. Okay,
Yeah.
fine, right, okay.
It would be through
Right, right.
Prescott.
Chris Cobb, they couldn't appeal. Hold on, Mr. Trump. Councilwoman Brown, were you good with the question? Okay. Councilman Brown reserves, Councilwoman Brown, I'm sorry, reserves. Mr. Olivier, were you finished?
Yeah, I'm done, yeah.
Okay.
I want to make sure there's a control factor built into the system.
Okay, and Mr. Trahon? Good, everybody good? Andy, you ready?
Bruce Hart, I don't think it's clear.
I don't either.
You know, there's at least a mention in the whereas section that it requires a state of an emergency. It would need to be in the resolved section, so it would appear to me that if that's the intent, to remove the emergency declaration provisions, there should be one more paragraph in the resolved section, removing that from the original resolution that was adopted.
And I think that is what came out of committee, that language was to be removed. So I would offer,
Before you do that, Councilwoman, is there anyone else on discussion on the main motion? Hearing no other discussion on the main motion, the gentlewoman has the floor.
I would offer that substitute motion to add the language that would delete the part of the original resolution that required it to be a declared state of emergency by the parish president.
The gentlewoman has a substitute motion to amend the language. Is there a second? A second by the gentleman, Councilman Trahon. Is there any discussion on the second? You good? Everyone good? Okay. On the substitute motion that Ms. Broussard offered, hearing no other discussion, roll call. Those in favor will signify by saying aye.
Aye.
Any in opposition? Hearing no opposition, the ayes have it. The motion carries unanimously. Moving on to summary number 43, introduced by the Library Board. Madam Clerk.
A resolution amending the 2021 Public Library Fund budget in the amount of $513,495 to carry over funding for replacement library branches in Coteau and Lorville, all to be funded from the fund balance previous year line item.
Do I have a motion? Man, that was everybody at one time. I have a motion by Councilman Paul Landry and a second by Councilman Eugene Olivier. Mr. Landry. Mr. Landry waves, surprising. Mr. Olivier waves. Is there any other discussion on the agenda item? Hearing none, the roll call. Those in favor will signify by saying aye. Aye. Is there anyone in opposition? Hearing no opposition, the ayes have it. The motion carries unanimously. Summary number 44, introduced by the parish president. Madam Clerk.
A resolution requesting the Louisiana Department of Transportation to install traffic light operations that can be viewed from the existing traffic light at T&S Milling, which is located at the corner of Avery Island Road and Highway 14, District 2.
Do I have a motion? Man, Mr. Landry's on a roll tonight. I have a motion by Councilman Paul Landry and a second by Councilman Marty Tron. Mr. Landry.
Waive.
Mr. Landry waves. Mr. Tron. Mr. Tron waves. Is there any discussion? I thought you waived.
Wait, I know. I'll just talk about that. We
Okay.
turned it in to the MPO also, at the Slyman the other night. I turned it in
Okay.
also for them to pick it up and look at it.
Okay. Mr. Tron, Mr. Tron reserves. Mr. Pollard, Councilman Pollard.
I'll follow up on what Marty was saying. I was wondering if it got turned in.
Okay.
Good, thank you.
Mr. Pollard reserves. Anyone else? Hearing no other discussion. Roll call. Those in favor will signify by saying aye. Aye. Is there any opposition? Hearing no opposition, the ayes have it, and the motion carries unanimously. We do have an expansion. There should have been an expansion packet provided at your table. It's number 1, to discuss and consider a motion to expand the agenda to discuss and consider the following items. Summary number 46, introduced by Acadiana Fairgrounds Commission. Madam Clerk.
A resolution amending the 2021 Public Buildings Maintenance Fund budget in the amount of $13,721 to provide funding for repairs to the sprinkler system and to 2 restrooms at the Acadiana Fairgrounds, all to be funded from the Public Buildings Maintenance Fund budget, fund balance previous year's line item, and further amending the 2021 Acadiana Fairgrounds Fund budget to accept said funding for these repairs. The purpose of this expansion is to provide said repairs as soon as possible in order that the facility is operational and available for use by the general public.
Do I have, I'll need a motion to go into public hearing. I have a motion by Councilman Paul Landry and a second by Councilwoman Natalie Broussard. This is just to go in public hearing. Roll call. Those in favor will signify by saying aye. Aye. Is there any opposition? Hearing no opposition, the ayes have it. We're now in public comments. Is there anyone from the general public that would want to speak on summary number 46, the expansion? Hearing none, I'll have a motion by Councilwoman Broussard and a second by Councilman Olivier. Is that right? Councilman Olivier. Roll call. Those in favor will signify by saying aye. Aye. Any opposition? Hearing no opposition, the ayes have it, and the motion carries unanimously. Next, I'll need a motion to suspend the rules as the item did not go to the joint committee. Do I have a motion?
Move.
I have a move by Councilwoman Broussard and a second by Councilman Brian Napier. Roll call. Those in favor will signify by saying aye.
Aye.
Is there anyone opposed? Hearing no opposition, the ayes have it, and the motion carries unanimously. It's time to expand the agenda. The agenda of this motion, I'll need okay, this is going to have to be a unanimous here, so I'll need a motion.
Move.
A move by Councilwoman Broussard and a second by Councilman Napier. All those in favor will signify by saying aye.
Aye.
Is there any opposition? Hearing no opposition, we have now expanded the agenda, and I'll need a motion to vote on the item. I have a motion by Mr. Paul Landry and a second by Councilwoman Natalie Broussard. Wow, that was amazing. That was
Like an year.
all right. Who's the highest bidder? Councilman Landry waves. Or did you want to talk, Councilman?
I'm going to just make a quick
ahead.
comment on this. During the freeze, they had the flooding, freeze of the pipes and everything like that. Mr. Pat Corline's there. So they bought the backflow preventer and they got water to the concession and the restroom up front. But the sprinkler and watering the arena that they have to roll over and everything like that, and the back restroom and all like that. So this is something that I think we just really need to get them back up. They've been booked, and it's gonna still for a week or so they're gonna have to deal with the problem. But the plumber, if we can get this, he's holding till Monday to keep his space open to do the job, and I think it'll get us back in where we need to be.
Councilman Landry, thank you for your leadership, sir. Councilwoman Broussard.
Wait.
Councilwoman Broussard waves. Is there any discussion on this agenda item? I know Mr. Pat Corlin's here, just for the public's, I guess, viewing at home and those here tonight, if you want to kind of give us some visual of what we're seeing here, Mr. Corlin.
Thank you. My name is Pat Carline. I am the chairman for the Sugar Arena Commission. As soon as they get it on board. Okay. I might have to go up there and do it.
Go ahead.
Okay, if you look where the arrow is, these are pipes that run on the top. Okay, and what's happened is they have cracked. You can see where the arrow is. There's a crack left. There's a pipe left. We took all the bad pipe down because of the fact we did not want anybody to get hit by the pipe in case it accidentally fell. If you look to the right of the arrow, you can see where there's one crack. There's some more that are cracked there, but those run along the top side of the arena. And there you go, right there. You can see another one, but there's more than that. It's about 2,400 worth feet of pipe that has to be 2-inch pipe.
2,400 feet?
That has to be replaced. You can see where the gaps are. There's another one, a few here, there, that whole area right there is gone. And the pipes that you see to the left, that's what goes to the sprinkler system to drop the water onto the ground so that we can wet it and then plow it through to make sure that the ground is okay for the horses when they have to get on it.
So those pipes, that's all water running through?
That's all water, nothing else but water.
Let me ask something, so would it be beneficial, not knowing when the next one's gonna come, to wrap those pipes so that it doesn't happen again, like with that pipe wrap?
I don't think we would have needed it because of the fact that all the water didn't get drained out of the pipes. Okay, the pipes at the bottom have a plug that you can undo. It's supposed to make the water go down. But the problem was the water didn't drain properly. We're going to be taking care of that because we're going to have a system in place. Okay, and so because of that, you know, water expands when it freezes, and what happened, it just expanded. There were places that we couldn't do anything about. We've never had a problem on a freeze before.
That's what I was gonna ask you. You
Right,
never had that.
and that's why we never wrap them.
Okay.
Okay.
I got you.
You can see there where the pipes are all broken. That's pipes that we actually had to take down to make sure that nobody got hit.
Yeah.
You see all the openings here.
Yeah.
Now this is kind of sideways, but this is the main water system. It goes to the in between the men's and ladies' restroom. Inside there's a mechanical room. The water comes in there, then it's fed to this, okay? And if you see all the little knobs on the deal, the blue knobs that you turn on and off, which is located like right here, it's upside down, I think, but these knobs right here, they open up, and that's how the water flows across to all of the other parts of the sprinkler system. We had a big break right here on the left-hand side, approximately right there. That was the biggest break right there, and that's where all the water was coming out.
Yeah. Wow.
When it broke. So that meant that it just, until we could have gotten in and shut it off completely. Yeah, that's just, you know, it's just a lot of pipes. And it's been there for a long time. You know, the pipes probably were brittle also, because we've never had, as long as I've been there, we've never had any problem with the system. But this freeze, it really created a bad problem between that and the two bathrooms in the back.
Councilman Napier, you finished?
Yes, sir.
All right, Councilman Paul is recognized.
For the funds that they're asking for, that's gonna replace all the pipes?
That's
or
replacing,
just
that's fixing everything.
Everything?
Yes.
Okay, what about the labor, y'all?
That's all part included in the price. The bid on that we had, that you have a price on, is gonna replace 2,240 feet of 2-inch pipe for the sprinkler system, 16 valves, the man lift rental, move in and move out time allowed for others to use the lift, diesel, repair work in the 2 satellite rooms, labor and materials, and replace the flush valve, faucets, P-trap, and ground level hose on the satellite restrooms.
Is this something y'all have to bid out, or y'all?
We've already taken, we've had the 3 bids.
on there, Mr. Paul.
These are 3 bids, and that was the lowest of the 3 bids. One of the bids was like $27,000.
Mr. Pollitt,
I'm
finish?
done. Thank
Mr.
you.
Pollitt reserves. Anyone else?
Lady Brown.
Councilwoman Brown is recognized.
How much of the pipes would you say that's being replaced is the total, like, the total amount, well, percentage of piping in the arena? So say, is it like 80%?
Oh, yeah, it's a very big percentage of
It's a
that.
big
Yes.
percentage.
I haven't asked him. I know that's a lot of, because he measured everything. He measured all the lines from point A to point B.
So it's about 80%?
I would say so.
And that's PVC?
Yes, it is.
Okay. I'm just throwing this out there.
Okay.
My pipes bust
Right.
during the storm too, and so we went with, PEC.
Yeah, well,
But I had to redo my-
well, let's look at that. We did look at that.
Okay.
And I think it went up. I forgot how much it was. It was very expensive.
This is 2-inch pipe, so the PEX that you put in your house are really small compared to this right here.
Which would have been, and it would have really been a cost factor.
Councilwoman, you fine? Good. Councilwoman Brown reserves. Anyone else? Mr. Carlisle, thank you for all you do for our parish.
Thank you.
We appreciate you, sir. I'm sorry, Mr. James Stronghold?
Yes.
Excuse me.
What kind of measure y'all putting in place so this wouldn't happen again? Are y'all gonna put some type of valves in line to bleed
Well,
the
the
lines?
valves have been there, okay, but the problem was they weren't open, were at the bottom. For some reason, they didn't open them. Don't know why. Like I said, we didn't go through, the maintenance man and another gentleman were doing making the walks and so forth and so on. I think it's something that they just overlooked because we've never had the problem of having to drain the system, okay? But at the meeting last night, we said that, we're gonna put up something in place, in writing, like a checklist, that when it does happen again, hey, you check this off, did you do this, did you do that, and so forth and so on. So we have, a way to make sure that everything is done properly.
Okay, that's what I was thinking. It just didn't get drained.
Yeah, it just just didn't, it was just it was oversight. The gentleman we had was new. The other one that was there never did go over with him or whatever to show him what would need to be done as far as where the drain things were and everything. It was just a lack of communications.
Okay, thank you.
Councilman Stronghold reserves. Councilwoman Brown is recognized.
So with replacing the piping and then having the valves open, just say the next week, you don't foresee this happening again if the valves are open?
No, if the valves are open on the bottom, it has enough lift that it will drain the system. You shut it off between the two bathrooms first. After that's been shut off, then you go around and you take every valve and open it up and make sure that, that there's air going through it so that way the water can flow where it needs to be. But at the bottom of some of the main lines, there's another plug. You got to turn that plug and be able to let the water drain down that way. And that was what happened. It didn't get drained.
Councilwoman Brown reserves. Anyone else? Hearing no one else, I'm sorry, legal counsel. Certainly.
We want to make it clear that this is well below the bid amount for a public works project. And so these were solicitations. They were not bids. Didn't have to be bid, but if you're going to do this, you're always going to have to try to get at least 3 quotes, solicit at least 3 quotes, which they did in this case, solicit 3 quotes. So they complied with the public bid law, which would not apply in this particular case. So solicitation's not, it's just.
I was just thinking, think it was anything that was more than $5,000 or.
Yeah,
Well, I think we have a parish policy.
We get quotes on anything above, at 1,000 or above.
Okay. That's the parish policy, right?
Okay.
No, go ahead. You good? Okay, Councilman Pollitt's finished. Anyone else? Hearing no one else, roll call. Those in favor will signify by saying aye.
Aye.
Is there anyone in opposition? Hearing no opposition, the ayes have it, and the motion carries unanimously. I'll need a motion to adjourn. I have a motion by Councilman Pollard and a second by Councilman Michael Landry. Those two gentlemen, I imagine, wave. Hearing no discussion. Roll call. Those in favor will signify by saying aye. Any opposition? The ayes have it. We're now recessed.